Welcome to the Ricky Matthews Show from the Citizens Bank studio. I'm thrilled that you're joining us, and I appreciate, so many people joining the show in so many different ways. Some of you are listening across the state of Mississippi on SuperTalk TV at C Spire TV. Some of you are watching after it airs on the radio at YouTube or Facebook or listening on your favorite podcast. But a lot of people are paying attention on the radio. It's been great to continue to get feedback because I think the more we talk on this show about what it takes to build a great region of Mississippi, and now that the show is actually rolling out on Thursdays to the Jackson and Delta markets, it will go further than that over the coming months. It's great to be able to introduce people from the rest of the state back to coastal Mississippi, but really, it's really awesome to have the opportunity to introduce coastal Mississippi to the rest of the state because, at the end of the day, we're all in this together. That is for sure. Hey, we have a very special guest today, but before we get to our guest, I just want to share something I came across as we enter Lent, now a few days into it. I came across something the other day that said that we're not picky enough about the way we manage our lives. Think about that for just a minute. We're not picky enough. We're not picky enough about our time. We're not picky enough about what we think. We're not picky enough about the way we spend our time or our nutrition or our priorities. I think that's a good point. And what it said was we should be pickier. We should be a lot pickier. Maybe during this Lenten time, it's an opportunity to sort of reflect and say, okay, what are our priorities going to be, and how are we going to move forward? I personally, it was the clarion call, this notion around need to be pickier, that caused me to retire. And I thank God I had the option. Not everybody obviously has that option, but I decided to be pickier. I'd been a CEO for 16 years of my life. My calendar was full. I had very little control over what ended up on my calendar. The strategic priorities that I was involved in often were determined by others. Certainly, I had a voice in it. But it's not healthy. And one thing that I've mentioned many times, I've been able to find balance. The thing that always brought it back home for me was, number one, I kept my family number one, and I never lost sight of the community. But I have brought sort of that desire, that passion into retirement, which is one of the reasons I'm doing this show. It's a great opportunity to be able to do this. Hey, by the way, I also ran across something. It was someone sitting there thinking, and it said, me figuring out a way to tell my boss that I don't want to work anymore, but I still want to get paid. See, how many people literally think that way? I'm not talking to you, but if you do think that way, maybe listening to the show and learning what it takes to be successful, learning from our guests, learning how important it is for us to come together and burn the midnight oil for our community. Maybe you'll be inspired by that and not actually think that way. Okay, so now let's shift gears. I'm so thrilled today to have Laurin St, who's the CEO of Singing River Health Systems, and someone I know his family extremely well. So it's really quite amazing that he and I have not literally crossed paths before, but I think we both would say we sort of know each other because we've heard about each other for a very, very long time. But anyway, without any further ado, let me welcome my friend Laurin St to the Ricky Matthews Show. How you doing, Laurin?
I'm doing great, Ricky. Thank you so much for having me on.
Well, listen, as you well know, your dad and I, Jerry St. the former CEO of Ingalls, who in his 80s continues to give back to the community in very significant ways. Your dad and I are close. And, I remember when I was publisher, I certainly remember well after Hurricane Katrina, where he and I spent an awful lot of time together. I always heard from your dad. He has this innate ability to take in just massive amounts of information and data. And I would compare it a little bit to Haley Barbour, the way Haley Barbour is able to put everything in their proper files inside their heads. And so when he's able to pay attention in that way, he can read something in the newspaper and it will trigger a thought, and he'll send me a text about it. And 2 years from now, he'll remember the text. But just a really powerful community leader who really understood the role that Ingalls played in our community as an economic engine for the state. But he also understood that he had a very unique responsibility to give to the community. And so even long after retirement, he continues to give back to the community. That has to have been a great inspiration in your life.
Oh, absolutely. I'm one of the fortunate people that have the a luxury of saying that their father is one of their role models and heroes. Obviously he's been pretty successful in his career, but the thing that's kind of sets him apart is he genuinely loves people and he loves this community. And he often says that he wasn't born in Mississippi, but he got here as quickly as he could. But he has a true passion for Mississippi and the Gulf Coast in general, and couldn't ask to have learned so much from a more talented individual. So certainly blessed to have him in my life.
Yeah, we share a lot of commonalities in our life. I mean, obviously, I went over to New Orleans to be the president of NOLA Media Group, the publisher of the Times-Picayune and NOLA.com. And your dad grew up in New Orleans and was literally a photojournalist, which is what ultimately brought him to Ingalls. And to watch his ascension in Ingalls, the way he worked his way up and had success. A big part of that success really was his ability to connect with unions, with diverse workforce, and all the things that he did. Again, you got to be smart to start out with. You got to go into the conversation to have an opportunity to be CEO of Ingalls, smart as hell to start out with. But then when you take that smart and you combine it with the ability to connect with people and care about the community, it's almost like the perfect formula for success, isn't it?
It is, and again, I think that sets him apart. He's never forgot where he came from, and he really genuinely likes people. The everyone that he works for, he always put them ahead of himself, and he continues to do that even long after his retirement. So that's still one of his big focuses.
Hey, listen, I've really appreciated the conversations that I've had regarding Singing River Health Systems over the last several years, watching it through this sort of, going through the strategic alternatives, essentially looking for potential new sellers or new buyers, excuse me, and we'll get up to date on that here in just a second. Watching how the team has dealt with what were some pretty significant financial challenges that the hospital faced. You were in the midst of that. You came up on the financial side of the company. And then also the work that you do in the community. In fact, just last week you had a healthcare summit that was really important. Emma Benoit, who I've had on the show and had many conversations with, who is a suicide attempt survivor, has got a great story to tell, and her ability to connect and remind young people about hope. But, on so many cylinders, on so many different dimensions, I've had the opportunity to chat about the importance of this hospital as an economic engine, as an employer, of course, what it does to increase the quality of healthcare, and the way you guys have strategically thought about the future and the challenges of the future and what the new buyer of the hospital might need to bring to the table. So it's been a really interesting journey for me. I've learned a lot, and we're going to get into all those things here shortly. But before we do, I want to go back a little bit in your life. You went to the University of Alabama, and did you know what you wanted to do when you went there?
I actually started off as pre-med. I wanted to be a physician. I know you and I have chatted before, and I think that was one of your aspirations as well. But my first chemistry class pretty much weeded me out of that path. But I always knew I wanted to be a part of healthcare in some form or fashion. So I got that degree in healthcare management from the University of Alabama.
And then you went to University of South Alabama, and after having been publisher at the Mobile Press Register, and got pretty close to the former president of South Alabama, the work to build a new stadium, to build an incredible campus. For a lot of people, University of South Alabama is out of sight, out of mind, but it is a little economic engine of its own, isn't it?
Yeah, it is. I tell you what, I graduated, got my master's there 25 years ago, so it's come a long way since I attended. But the school was fantastic, even when I was there 25 years ago. Couldn't ask for a better education from the school.
So, Laurin, when I think about you, and then I look at what you've been involved in the community, clearly, just like with me, it was built into your DNA that whatever you did, you're going to have to be involved in the community. But was that just required of you, expected of you?
I don't think it was expected or required. I think that was probably, again, just being raised by both my mother and my father, who genuinely given back over their careers and just instilled that into myself and my sister.
So, hey, so coming back to your time at River Health Systems, you land there, and you've seen a lot of change happen in those 25 years. What was okay? I tell you what, I'm going to talk about high points and low points along the way, but we'll pick that up on the other side as we continue our conversation with Laurin St, the CEO of Singing River Health Systems, and we're going to get a great update about where the hospital system is today, and you're going to get to know Laurin better as a result of it. So we'll see you back after this break. Welcome back to the Ricky Matthews Show from the Citizens Bank studio. I have my friend Laurin St, who's the CEO of Singing River Health Systems, and we're gonna kind of cover the waterfront as it relates to this health system. And before we get into where I was headed, I'm going to talk to you about, in this 25 years, there's been some highs and lows, but overall, I think the health system emerges out of it really positioned to tackle the future. I think you would agree with that. What I want to do, though, real quick, is let people who, in the old days, they might have thought of Singing River as just being the Pascagoula Hospital. But over the years, it's expanded and it's diversified and lots of stuff. I mean, the footprint in coastal Mississippi is pretty significant. So why don't you give people a sense of that footprint?
Yeah, so currently Pascagoula Hospital is our largest hospital. We have an average daily census of about 135. Our Ocean Springs Hospital has an average daily census of about 110. And our newest hospital that we have in Singing River Gulfport, about in 2020, has an average daily census of about 55. But our footprint is pretty expansive. We now have 41 outlying clinics across multiple counties that we serve, and continuing to make sure that we improve access to care, but also making sure when we do that, there's a return on investment, smart growth, not growing just for the sake of growing in of itself.
Hey, listen, what's interesting along the way, the hospital touches people in different ways, but I remember my brother-in-law needed bypass surgery, and he had the ability to go wherever he wanted to go. I mean, he could have gone to Birmingham or New Orleans or wherever. And he chose Ocean Springs. And the reason he chose Ocean Springs is because you guys have built a really, really strong team there. His experience there was phenomenal to him and his health. He had a great outcome, and he's doing really well today. But, you don't think of small hospitals like an Ocean Springs, for example, being a leader in something like heart care. But you guys have really, you said, we're going to do that, and you've done it. And that's a great story to tell, isn't it?
It is. Our cardiac program is one of our leading service lines, one that we're very proud of and have been for many years. We were the first on the Mississippi Gulf Coast to enter into the structural heart program, basically have the ability to go in, with very minimally invasive technology to replace heart valves. Basically, you had to crack your chest in years past to do that. So we're very, blessed to have outstanding cardiologists, cardiothoracic surgeons, nurses, techs, you name it. We're, very blessed. And that's what makes it all happen. You can have the latest and greatest technology, which we have, but it's literally the team and the caliber of, individuals that, use that technology to make a difference in people's lives.
It's a big deal, and it's helpful. It's helpful to coastal Mississippi. You think about the role the hospital system or the healthcare system plays. It's got to be part of the economic engine, not just in terms of providing healthcare to people who work and live in this region, but also just by virtue of the size of your organization and the number of people you employ and whatever. But the economic impact in our community, not just Jackson County, is very significant, isn't it?
Yeah, we have 3,695 full-time and part-time employees across our system, and obviously earning a good wage. The estimate is about $1 billion impact on our community. So to your point, and again, that's why on top of the quality of care that we're providing here to our communities that we serve, the economic impact is very important. And that's why the RFP that we went through recently got so much attention from so many different people.
Yeah, there's no doubt. We'll cover that here shortly. Hey, listen, you joined the Pascagoula Hospital as a programs administrator back in 2014. I wonder if in your wildest imagination, if you thought 25 years later you'd still be there and also the CEO of the entire health system.
No, absolutely not. I actually started in the organization in 1999. I started off in the finance department. Did that for about 4 years. Had the opportunity to move into operations, and then had the opportunity to actually lead our cardiovascular program. So I'm pretty passionate about that service line. I did that for about 8 years, and then in 2014 became the administrator of the hospital, as well as all of the ambulatory services throughout the system.
Yeah,
so, yes,
good.
Did not think I was going to be the CEO there.
Thanks for reminding me that 1999 for sure is when you joined. Listen, that financial background that you built, a lot of it experiential. I mean, coming into the hospital and really understanding, it's complicated. It's very complicated. The payments come from all kinds of places, and in some cases, payments don't come at all. But managing a hospital in that environment, and then you kind of reached a point at the hospital where there were some significant financial challenges. That made you a better CEO to have gone through that, didn't it?
There's no question. I think that, having gone through, an $88 million accounts receivable audit, which was the, largest in healthcare at that particular point in time. Not sure if anybody's eclipsed us. Hope they have not. But, certainly, I think it helped us get some things in line that needed to happen that, I think others faced kind of further down the road. I think it helped us for the pandemic and making sure that we were as efficient as possible. But you can get all the education in the world that's out there, but there's nothing like on the job learning experience like that. It's one of those. Hindsight, it was outstanding at the particular point in time. Not certainly. I don't know if I wanted to go through that, but again, it was a very good learning experience, no doubt.
Well, when you came out the other side of that, though. It was this is a very unique hospital in that it was owned by the community. The board of supervisors had a role. You have a board of trustees, a lot of trial and tribulations. But at the end of the day, with that experience and with some smart decisions along the way, the hospital sort of repositioned itself. But then, you probably knew early on, and probably weren't talking about it publicly, but you knew early on that with the changes in healthcare, we were going to find ourselves in a position, at least the hospital was going to find itself in a position where it would not be able to address the challenges of the future if it didn't have more scale connected with it. And ultimately, the trustees made a good decision. The board of supervisors did as well, and you started to seek strategic alternatives. You weren't surprised to be in that position, were you?
No, we were not. I mean, we've been thinking about, partnering with a larger institution to get some economies of scale 2 years prior to the ultimate RFP that went out. So, no, it's, healthcare is challenging, and, the larger you are, it helps you, weather storms, like pandemics and other things to a greater degree.
Yeah, it's speaking of the pandemic, incidentally, you guys, while there were many, many challenges, I actually had the opportunity to come over there and spend some time with your team and see the impact on the hospital system is just absolutely dramatic. But you still came out of it fairly well financially. And a lot of hospitals couldn't make that statement, but you guys couldn't you?
We did, and again, Ricky, that's a testament to the entire team. I mean, the challenges from the frontline staff up to the mid-level managers. I mean, the work that they did was something that's I'll never forget. Anytime you go through a challenging situation, there's silver linings, and quality of care literally was the number one focus throughout that entire process. Finance was on the back burner at that particular point in time, and I think that goes to that's for every single healthcare system across the country and frankly across the world. But you got to put patients first, and could not have asked anything better from our team with regards to the efforts they put into that.
So when you come out on the other side of the pandemic and you start to think about the incredible capital requirements that to build, because you have innovation that's happening, all kinds of equipment that has to be updated. I mean, you have to spend, I don't know, tens, maybe hundreds of millions of dollars. I don't know what the actual number is, but the investments required to keep a hospital system like Singing River Health Systems on the cutting edge, it is very significant, isn't it?
It is. I mean, our typical, capital budget's somewhere around 20 million. So, we've got to make sure that we, again, we are a not-for-profit health system. And would not want to be a part of anything else, to be honest with you. And the suitors that we were looking for from an RFP standpoint were also in the not-for-profit status. But just because you're a not-for-profit health system does not mean you don't have to have a bottom line, because you've got to continue to reinvest in the capital, make sure you have the cutting edge technology that you need, but you also have to reinvest in your people.
Yeah.
All right. And so, again, we do have the luxury. We don't have to send our dollars off to Florida or, Nashville or anywhere else to shareholders. We get to reinvest that back into our organization, our people, and ultimately serving our community. So, again, that's a testament to the team that we're able to continue to do that.
So the RFP process went forward over the course of many, many months. And you ultimately, well, I tell you what we'll do. We're at the end of the segment. You can kind of update people about where we are as it relates to all that. And then we'll talk about some of the expansion opportunities you guys are involved in going forward. Just going to really, I think, solidify you even as a better healthcare provider in coastal Mississippi. We'll see you after this break as we continue our conversation with Laurin St, the CEO of Singing River Health Systems. We'll see you after this. Welcome back to the Ricky Matthews Show from the Citizens Bank studio. I have Laurin St, someone I love his family. His dad is what I would refer to Jerry St. as a stalwart leader in coastal Mississippi, someone I really enjoyed working next to. So no big surprise that one of Jerry's kids, in this case Laurin, it becomes the CEO of one of the most important healthcare systems in coastal Mississippi. So it's a delight for me to have the opportunity to share his story, and also to talk about what it takes to build a strong healthcare system in coastal Mississippi. As I mentioned before we went to break, though, there was you had a board of trustees, nonprofit. You had a role for the board of supervisors to play. They went through lots of discussion, but at the end of the day, they went through an RFP process. Why don't you kind of take us through that process and then also where we landed?
Yeah. So, obviously, at the beginning of this process, I will tell you that the administration, the board of trustees, and the board of supervisors were all aligned with regards to ultimately what we wanted this to look like at the end. And, the board of supervisors, with the input from everybody, actually, and again, this is a true testament to their leadership, put actually minimum requirements in the RFP process at the very beginning. And those are things like making sure that, we kept the service lines that we currently have for Singing River Health System, kept our emergency departments open at our campuses, and making sure that the mental health spend that we currently have at Singing River Health System maintained at that level or greater. Obviously, mental health is a big challenge across the country, but certainly right here in coastal Mississippi. So, we want to make sure that was intact. But also make sure those employees that we have who are in good standing had a job at the end of this RFP process. And, if any particular point in time, the negotiations between FMOL at that juncture did not meet those minimum requirements, then the Board of Supervisors could pull out. And that is exactly what happened. And I'll be honest with you, and I've told the supervisors this many times, I could not have been more pleased ultimately, with the ultimate outcome, because, again, those minimum requirements were so important to all of us. And again, we were aligned on those. And when the negotiations, again, mergers and acquisitions out after the pandemic kind of started slowing down. So, it wasn't any surprise that there were, some changes that FMOL wanted to put in. Again, they're a great system, don't get me wrong. But again, just times had changed, financial situations changed for them, and it ultimately was not in their, best interest unless they could get these things in there that ultimately allowed the those minimum requirements to not be met. So could not have been more pleased with it. And all along throughout the RFP process, we have maintained since the beginning that we were going to operate like we were going to be independent and we were not going to be bought. And so I think that mindset from everybody on the team helped us, go through that RFP process pretty much, unharmed and, in a better position actually from a financial standpoint.
So what happens now, Laurin? Do you consider strategic alternatives going forward, or what's the thinking?
Yeah, we'll always be looking at opportunities to partner with other health systems. Again, maybe not necessarily in a RFP format. I don't think that's in our future anytime soon. Again, we are in a better financial situation because of the entire team here at Singing River, from the front line up to the middle managers. Again, they do an outstanding job, and we are in a good position right now. But look, I don't have a crystal ball. All we need to do is continue to execute on our strategy and let everything else fall where it may. But again, we're in a good position because we have maintained that mindset ever since the beginning of this RFP process.
Well, you went into the process strong, that's for sure. You end the process, as you pointed out. Sometimes it does enlighten you. It makes you smarter. Well, hell, it makes you a lot smarter, actually, because you do a lot of current process analysis and you're looking for, how does the transition look and how does the fit look and all these things that are part of it. And, to come out of the other side of it and still thinking that you can stand alone, you don't have to necessarily at this point in the juncture, because you're not closing future doors. You never know what's going to happen. Have to seek strategic alternatives that you can continue down the road and stay focused on your strategic plan and building a quality healthcare system for coastal Mississippi. That's a pretty good place to be.
It is, and like I said, having a team in place, my executive team's got over 270 years of experience at Singing River alone, and when you have that type of experience, it's certainly absolutely invaluable when you're navigating, RFPs, cyber attacks, or just day-to-day healthcare initiatives. And, again, the frontline managers and the entire team, that's what's driving all this. I just happen to be, sitting in my position at the time, but they're actually the ones doing all the work.
Well, okay. So you had responsibilities early on in your career about expansion of cardiology, but that and orthopedic services are still very much on your radar screen to get stronger. What's going on there?
Yeah, so just to clarify, man, we've got 4 pillars on our strategy. Quality will always be number one. We've got to maintain that, and that's got to be at the forefront. The next one is efficiency, making sure we've got selected our payer mix. We have 65% that is fixed payments, so we got to be as efficient as possible. 17% that come through our emergency department have no form of insurance, so we got to be as efficient as possible. Growth is clearly one of those, and orthopedics, cardiology. We've just opened up a brand new cardiology clinic in Gulfport at the MOB that's right adjacent to Singing River Gulfport with Dr. Hand, Dr. Cunningham, Majerus, Aga, and again, growing volumes in that location. We also have Dr. Myers clinic in Ocean Springs from an orthopedic standpoint. Again, continuing to grow. We're actually recruiting another orthopedic surgeon to join Dr. Myers in that location. So again, a lot of great things. But again, the secret to the growth in healthcare is making sure that there is a return on investment when you're doing that. And the last pillar, I just have to mention this, Ricky, is people. We've got to make sure that we are retaining the best of the best, recruiting the best of the best, because you can have all of the latest, greatest in technology. If you don't have the people to operate it, you're not going to be there. So that's our mission there, is to continue to focus on our strategy.
Well, we talked a bit about this before the pandemic, and that is that certain sectors of healthcare were already facing shortages, whether it be nurses or whatever. Certainly the pandemic really brought that into stark focus, and then the whole notion around traveling professionals, nurses and others became part of the conversation. But again, you mentioned healthcare. Healthcare, probably one of the biggest deficits we have is in the healthcare sector. In conversations with Angel Myers McElrath, the DA in your area, she said that just about every case they deal with has some kind of mental health issue associated with it, and they can't get the care that they need. So it's got to be a big priority for you guys.
It is, and as you pointed out, the pandemic did not cause the labor shortage. All it did was exacerbate and kind of put it in fast forward a little bit. So we still have shortages across our system at just about every position level. But we realized that coming out of the pandemic pretty early on. And, thankfully, we were able to get some grant funding from our coastal delegation to help us build a workforce academy. And we've actually got the building that's going vertical over in Ocean Springs. Had the opportunity to share that with some of the coastal delegation to show them where their money is going to. But the education of that, Ricky's already started. We've implemented it a little over a year ago, and we've already had numerous graduates from the program, and the ability to have them earn a living while they are learning has been a game changer. I mean, we've had techs come out. We have CNAs that have graduated from the program. We've actually recently had 13 LPNs. That was our first cohort of LPNs in partnership with the Mississippi Gulf Coast Community College, and we had a 100% pass rate from the nursing program. And I had the opportunity, Ricky, to speak to one of those nurses, and literally, had tears in her eyes, explaining how she would have never had the opportunity to do this if she wasn't able to, earn a living for her family while she bettered her education and ultimately improved the life for her family. So it's a win-win for everybody involved.
I can't help but think about this while you're talking, that you're a chip off the old block, because I think about the work that your dad focused on, and not only as CEO of Ingalls, but then later around this need to do workforce development. And I think Mississippi, as a general rule, has really embraced that. I mean, I think about Mississippi Gulf Coast Community College. Over 50% of the students at Mississippi Gulf Coast Community College today are in non-traditional education. What a great step in the right direction by all of us, the legislature, the leadership of our state, you guys as not only significant stakeholders in this conversation, focused on doing everything we can to direct people in this community toward the kind of careers that they can hit the ground running with really good salaries and make a difference in this community. It's great to see. Hey, when we come back on the other side, we'll continue our conversation with Laurin St. Welcome back to the Ricky Matthews Show from the Citizens Bank Studio, and I have Laurin St. the CEO of Singing River Health Systems, with us. And we've really told an interesting story about his ascension in this company, and then, having tremendous responsibilities on the financial side to work the hospital system through some very difficult financial times. And then this whole notion of seeking strategic alternatives, learning a lot about themselves in the process, coming out on the other side, realizing that we're probably better off as a standalone system. And that's where the system is today. And they've got good leadership, not just in Laurin, of course, but a great team, many of whom I know and I've had the opportunity to have on the show. And they're all so dedicated to what's happening. Hey, two other major points I want to mention. First of all, GI, gastrointestinal, is an area you guys want to expand in. And then I want to then close with cyber attacks and what you've had to do to deal with that.
Yeah. So on the again, going back to one of our growth strategies, we realized that we had some opportunities to improve workflow in our GI capabilities over at Singing River Gulfport. So we've actually next week we'll have the ribbon cutting. It's actually already opened, but we've got a brand new 5-room endo suite. It's got 17 pre-op and post-op bays that will dramatically help us improve the workflow going through there. That opened on 1/17, and we've already done over 200 cases through that. So again, very busy. Once it's completely up and staffed, we'll be able to do up to 40 a day. So it's going to be a dramatic improvement with our workflow and ultimately being able to take care of the community with regards to GI services over there in Gulfport.
Hey, with some of the collaborations you guys had with Auctioner, will they continue?
Oh, well, so again, we still have conversations with all of the healthcare industry systems across the state of Mississippi and over into Louisiana. To be honest with you, we're working closely with Memorial and other hospitals in Mississippi to get some legislation across. So there is enough business for everybody, and the more we work together to ultimately care for the community, the better off we're all going to be.
Cyber attacks. I mentioned before we came back into this segment that we had to deal with one or two or three of those when I was in my prior world. But man, that can be a tough thing to respond to, can it?
Oh, it's probably it's up there with regards to one of the most challenging things that I've dealt with in my career. So on August 17th, it was a Saturday. I got a phone call at a little before 6 a.m. From our administrator on call and telling me that all of the systems across, all of our computer systems across the system were down, telecommunication systems were down. So we immediately went into downtime procedures. And what that means, Ricky, is basically taking care of patients on paper. So the time they came in the door to the time they were discharged, they would get a folder, and sometimes it would be, this thick with paper, and that. Anytime you go through a challenging situation, there's silver linings, and I will tell you, could not have been happier with the team, the entire team, putting patients first with every single decision that was made. Quality of care never checked up. Throughout that process, we were down for 13 days. All right. And so I actually had an opportunity to speak to a CEO that was hit by the same terrorist group, and that's exactly what these are. These are terrorists. And they were, when I talked to her, they were down for 5 weeks. So that's a testament again to our IT team getting us back up in 13 days. But just because we were back up on electronic medical records in 13 days, we had to take all of those documents that were in the folder and implement those back into Epic so we could ultimately put out bills. So we had no cash coming in the door for well over a month. And so that's it. Just to put that into perspective, I mean, it takes us, it costs about $1.5 million a day to run this operation. We were getting, a little bit north of that in per day from a cash standpoint. And at the lowest point, we had $22,000 coming in the door. So it is a significant financial impact. And, again, this is not unique to healthcare. This is, these people, as long as they're getting paydays at the end of this, they're going to continue. Fortunately, we were in a situation we did not pay a ransom. And, again, it's a sure testament to our IT team and actually the entire team taking care of patients through this process, but we were able to get back up and operational. Very challenging situation.
Hey, well, listen, man, one of the things I came to appreciate as a CEO, when I would come into a new company that we were involved in, I would get to know the HR director really well, and I'd get to know the IT director really well. Because if you had those two on your team, I mean, they know a lot. They know how the layout of the system, and they know the people. And you can't put enough emphasis on how important your IT team is to you, can you?
No, absolutely. And again, they have made tremendous strides since that event. Again, first of all, getting us back up, but we've implemented multiple different additional security measures already, and we'll continue to do that. You got to continue to adapt and evolve because, again, these terrorists are pretty smart. They know how to figure it out.
Laurin, it's been a pleasure to spend some time with you. I look forward to visiting again soon. Glad you guys landed where you landed. And, good luck to you and your team as you continue to build a strong hospital system for coastal Mississippi.
Hey, thank you very much. I really appreciate you having me on, Ricky.
It's been a pleasure. It's been a pleasure. I can see why your dad's so proud of you. Have a great day, and we will see you tomorrow.